All right, guys, welcome back to Underground Science. In this video, we'll be talking about common variable immunodeficiency. All right, so let's go and get started. So if we compare this to X-linked A-gamma globulinemia, which is what we talked about, right? Previously, in that, remember, you go from your pro B cells to your pre B cells, and but you're not able to do that. You can't go from your pro B cells to pre B cells, right? Because of the dysfunctional Bruton tyrosine kinase gene and the Bruton tyrosine kinase enzyme. So you're not able to convert from pro to pre B cells. Therefore, you can't produce any naive B cells. Therefore, no plasma cells and no antibodies. Okay, but in here, in common variable immunodeficiency, what happens is you have a much harder time converting from B cells to plasma cells. So you actually do produce B cells, but you are not able to properly convert your B cells to plasma cells in the time of a pathogen, right? When pathogens get introduced, we know that our B cells get activated with the help of our T cells, and then they differentiate into plasma cells and we produce antibodies. But in common variable immunodeficiency, there's a B cell dysfunction where, yes, you do have your B cells, but it has a very hard time converting to plasma cells. And if you barely have any plasma cells, then you're going to barely have any antibodies. That's why what you see in this disease is reduced immunoglobulin levels. As compared to X-linked A-gamma globulinemia, we see no antibodies, but here you'd see reduced because you're getting very little plasma cell conversion from B cells. So you're going to see very little immunoglobulin levels. In common variable immunodeficiency, you also see T cell dysfunction. And remember, you need T cells, right, to activate B cells. So if you have T cell dysfunction, it's going to further impair B cell activation. Okay, so that's basically the basic pathophysiology. Let's see the findings and let's make sense of it. So first thing we should say is the onset of this typically presents in adulthood as compared to X-linked A-gamma globulinemia. Remember, that presents after 6 months of age because for the first 6 months, the baby's protected with the mother's breast milk, right, which have antibodies to fight off certain pathogens. So again, in common variable immunodeficiency, it typically presents in adulthood. Okay, so let's go in order, right? And make sense of the findings. So if you're deficient in your antibodies, right, one of them being IgG, we know IgG is good for opsonization, right? Getting rid of encapsulated pathogens, encapsulated bacteria. But if you're deficient in your antibodies, one of them being IgG, then you won't be able to properly get rid of and fight off encapsulated bacteria. So that means you're going to be at an increased risk of getting infections relating to strep pneumo and Haemophilus influenza because they're encapsulated, right? And then if we just go down the choices, right? What's the next antibody that you may be deficient in, right? IgA is another antibody. Now, again, in this disease, we know that you barely have any plasma cells because you can't properly convert B cells to plasma cells. So that means you're going to have very low levels of antibodies or immunoglobulins. One of them we already discussed, IgG, right? Another one, if you have low IgA, then we know IgA is good for what? Mucosal defense, right? But if you don't have much IgA, your your mucosal defense won't be there, right? So what does that put you at risk of? Remember Giardia, right? Giardia lamblia, because that infects your GI mucosa, and you don't have IgA to protect you that well, right? You don't have much IgA, then you're going to be at an increased risk of enterovirus infections and also Giardia, which is a parasite, right? So that's that, right? So that makes sense, right? It would make sense why you would why you would be at an increased risk of a Giardia infection or an enterovirus infection, right? Because remember, enteroviruses are also infecting your GI tract, your GI mucosa, and Giardia infects your GI mucosa too, right? And we know IgA is important for defending against certain pathogens in your GI mucosa because this is present in your mucosa of your body, right? But if you don't have IgA, of course, it makes sense you're going to be at an increased risk of certain enteroviruses and Giardia, right? Remember the enteroviruses we discussed in the previous video? We talked about certain viruses Due to deficiency in antibodies, you can also be prone to infection from echovirus, right? Echovirus, poliovirus, which is a live virus, so you want to avoid these, right? In terms of vaccines, and Coxsackie virus, right? So these are the three viruses that that are count as enteroviruses too, and it's just important to keep these in mind, right, when talking about increased risk of enterovirus infection in people who have deficient antibodies. So we got echovirus, poliovirus, and Coxsackie virus, right? So let's finish writing that. Because remember, right, we talked about this in the X-linked A gamma globulinemia video. Remember, echovirus is not only an enterovirus, but it can also affect other places like, it can lead to, it can also cause, I should say, meningitis, right? Aseptic meningitis, and even myocarditis too. All right, remember Coxsackie virus, right, is an enterovirus, but it can also cause myocarditis, and even it can infect the pericardium of the heart too, right? The surrounding, the covering of the heart, which is going to be called pericarditis, right? And then we know, of course, poliovirus can lead to poliomyelitis and infect your anterior gray horn nuclei, right? So it's going to basically be infecting your anterior gray horn nuclei. And that's going to lead to decreased alpha motor neuron function, right? Because if you infect and kill those cells off in your anterior gray horn, then you no longer have proper alpha motor neuron supply to your skeletal muscles. So that can lead to lower motor neuron symptoms, right? Like flaccid paralysis, hypotonia, hyperreflexia, and things like that too. So we'll just say it infects your anterior gray horn. All right. So those are the viruses to watch out for too, due to decreased antibodies due to this disease, which is common variable immunodeficiency, right? And of course, you can also have like decreased IgM too, right? Of course, because that's also an antibody that your plasma cells produce. And if you don't have proper amount of plasma cells, you won't be able to produce many antibodies. Now, another thing to keep in mind that it's actually important to commit to memory, right, is that in this disease, you can also see other autoimmune diseases, okay, that are associated with the disease. For example, rheumatoid arthritis, all right, is associated with common variable immunodeficiency. And even ITP, okay, can be associated with it, which is what's ITP? Immune thrombocytopenic purpura, right? And what is that? So we'll do a separate video on this, but just to quickly mention what this is what basically happens is you make antibodies against your own platelets, okay, in this disease. So you make antibodies against your own platelets, and that causes destruction of platelets in your spleen. So that means you're going to have a low platelet count, hence the thrombocytopenia part of the name, right? Immune, because you're making antibodies against your platelets, and purpura, because remember, you get things like petechiae, purpura, and ecchymosis, right? If you have low platelets. So if you're destroying your platelets, you're going to have thrombocytopenia or low platelets, and that's going to lead to bruising or things like purpura, right? And of course, that happens because we know platelets are good for forming the platelet plug and helping you stop bleeding. But if you have low platelet counts, then you can see mucosal and skin bleeding, one of them being purpura, right? So low platelets, you can see things like mucosal and skin bleeding, which is what you would see in ITP, okay? Mucosal and skin bleeding. Okay, so that's basically a quick summary of what ITP is. But another thing to keep in mind is you can also see things like lymphoma that's associated with common variable immunodeficiency and gastric cancer. Okay, so it's important to know certain associations when talking about common variable immunodeficiency, right? So we talk about rheumatoid arthritis, gastric cancer, lymphoma, ITP, right? And if you want to commit another thing to memory, something else that can be associated with common variable immunodeficiency, right, is inflammatory bowel disease, right? So remember, the two main inflammatory bowel disease that we're familiar with is Crohn's and ulcerative colitis. right? So we're familiar with Crohn's and ulcerative colitis. So let's write that down. And ulcerative colitis. So those are our diseases that make up the inflammatory bowel diseases, right? And that's basically it. So it's important to know all these things, especially the pathogens that these patients have an increased risk of infection from, right? And even, I mean, certain you can add into memory that certain opportunistic infections can occur too in these patients if this common variable deficiency disease gets like extreme or advanced, right? So certain opportunistic infections to watch out for is bacteria like mycoplasma, right? That could be a pathogen to watch out for. Mycoplasma pneumoniae and even salmonella, right? So basically pathogens like that, okay, opportunistic infections. And of course, with these patients, just like we saw in X-linked A gamma globulinemia, you should avoid live vaccines, right? So those being like polio, the polio vaccine or the MMR vaccine or the varicella vaccine, right? So vaccines that are live vaccines should be avoided too because these patients can't make uh, proper amounts of antibodies. Okay, so it's important to watch out for live vaccines. Okay, that should be contraindicated. All right, so that's basically it for this video. That was common variable immunodeficiency. Um, I hope this video helped. I hope this video made a little bit of sense. As for treatment, right? Just so we don't forget that. As for treatment, so you have low antibodies, right? If you have low antibodies, then you would want to give antibodies. So like IVIG, for example. And if they get infections from bacteria, right, then antibiotics are a choice too. And then, of course, avoid live vaccines. Okay. So yeah, that's basically it for this video. Thank you guys for watching and see you guys in my future videos.